Welcome to Amalgama WellTech Hub. Dive with us into this new podcast where we explore the fusion of wellness and technology.
Hi everyone, welcome back to Amalgama WellTech Hub. I'm Belen, part of the business development team here in Amalgama, and I'm here with Tom, one of our co-founders, and Alex Stoller, our very special guest. Welcome, Alex. How are you?
Thank you. I am excited to be here. Appreciate the introduction. I'm doing well.
Awesome. So, Alex is the co-founder and CEO of True Health, and fun fact, he's also a dear former client of ours. He's been making waves in the healthcare space for the past 5 years, pushing for a more consumer-focused model that's totally redefining how we think about health and wellness. Again, Alex, it's great having you here. Thank you for joining us. Tom, anything you want to add?
I want to jump straight into the questions.
Okay.
Of course, Alex, you're here in behalf of True Health, and I know in the roadmap of every entrepreneur, there's a problem that you want to solve, in order to start something. So, which is this problem that you realized that was happening, and you thought you might have a good answer for it?
Yeah, so I guess for context, it's important to know too, I'm in the United States, so because our key market is focused here in the US, and the problem that consumers have in the healthcare system in this country are, I should really say, problems, because it's quite extensive. I mean, the problems are very evident in the statistics or the data when you look at what's happening with our country's health. And it's no surprise to anyone who's familiar with the issues that our nation's health is suffering primarily from preventable and very expensive chronic disease conditions, many of which are influenced by lifestyle factors. Now, I want to kind of overlay that with, it's not just about the choices people make in their lifestyle. There's a lot of players in large systems in this country, such as big food, the big healthcare industry, which influence people's decisions and also create a foundation for poor health, if you will. Via multiple kind of lifestyle factors. However, this main problem we're trying to solve is that our nation's health is suffering from chronic disease, and our healthcare system, i.e., these hospitals or your kind of traditional doctor's office, doesn't really solve that. We're a nation of reactive healthcare. Of reacting to people's acute and or chronic health conditions with kind of this Band-Aid medicine, and not very good at solving the root cause of people's health issues. So that's one component, and then we do that in a very unappealing way for consumers. So going to a hospital isn't a fun experience. It's very sterile, and often you're met with disgruntled front desk staff that doesn't enjoy their job and then sends you to a doctor who you see for 5 minutes. They give you a list of things you need to do better in your life and then say goodbye, and that's pretty much it. So people feel lost. People feel lost here in this healthcare system in terms of what to actually do to be healthier, and we're trying to improve that overall experience via better, more appealing, non-sterile spaces that are actually nice to be in, maybe even a place you look forward to going to, and with a staff that is there to support the consumer in their healthcare journey. So we're trying to also improve the kind of patient experience as we go along. And there's many elements to that, but I would say broadly, That's what the problems we're trying to solve for.
Okay, great. Would you say, like, on a personal level, this has affected you, like, in any way, like looking at medicine and healthcare in this way?
Yeah. So, my full transparency here, like to be vulnerable, I guess, in this is that, my mom she had stage 4 breast cancer, which had metastasized all over her body. So she suffered from metastatic breast cancer for basically 20 years. And, being part of that journey with her was very insightful. So, I mean, that's how it's affected me personally. The way the healthcare system exists now is, I watched her kind of suffer through that disease state without much consideration for the quality of her life. But the incredible doctors that helped her were able to prolong her life and keep her through iterations of chemotherapy that definitely added valuable years to her life. And so I kind of saw, like, here's the power of the healthcare system. Here's what it can do for people. And then how can we also introduce, like, these elements of lifestyle intervention to that system so that people are getting the best quality of life during those years that they have. And so, my mom's situation with unique cancer is a tough one. But, I would say, like, the thing that affected me most personally in this healthcare system was that, in addition to kind of just like my own healthcare experiences as well.
Thanks a lot for sharing that.
Thank you.
Yeah, super inspiring, and it makes a lot of sense. It's a huge purpose to be working for. And at the beginning of the conversation, I felt like it was impossible not to feel familiar, right, with all the health system and not really moving forward, and we got a really bad experience in terms of like having a good treatment, right, and also in terms of preventing things. So I'm wondering here, like, we're a tech company, and for us, technology is such a big part of pretty much everything. How do you see technology in general is affecting to this? Is this contributing to the problem or to the solution? What do you think?
Yeah, absolutely is part of the solution here. So the reason there's even a market opportunity for me to open up a business that is going to own and operate these healthcare practices is due to the kind of lack of innovation that there's been in the healthcare industry in this country with regard to like patient experience and treatment and incorporating preventive health. We've done a great job with technology in pharmaceuticals. I think that's one obvious realm. And then also you have kind of artificial intelligence coming in and likely making a big impact in the next 10 years in how healthcare is done globally. However, the way we view technology as part of this solution is for us to scale lifestyle intervention. So we have doctors, right? That's going to be a core piece of our business model, is that we have physicians serving patients. Your primary care physician sees you, has a much more personal interaction than they would at a standard hospital primary care setting. Rather than 15 minutes with a doctor or 5, you get an hour with the doctor. And the other element to this, and I'll bring this back around to technology, is that we have more comprehensive preventive health services. So we have, in addition to your primary care physician, they're part of a team that includes a registered dietitian and a physical therapist and a fitness coach, mental health practitioners. The way that medicine is traditionally delivered, like I mentioned, is they kind of write you a prescription and send you on your way. That's fine for a pharmaceutical intervention, but for lifestyle intervention, you need ongoing touch points, accountability, programming that changes as your health changes and your situation changes. So we're leveraging, and this is kind of how we engaged Amalgamas to help us create this technology, and what we plan to build over the long run is a way to scale lifestyle intervention. And so the clearest way to describe that is extending patient care beyond the office. How can we have people take home their care team in their pocket, right? Have the accountability to actually implement nutrition change, the guidance to do so, right? And that nutrition change, for example, is something that's a very long-term, journey for people that takes habit formation and like I mentioned, accountability. Same with fitness. You need ongoing fitness programming that changes as you get more fit or your body changes. Mental health. All of these are kind of habit-based, lifestyle-based interventions. And, one way we see technology helping us toward this solution is by extending that care beyond the office and enabling preventive health in the current healthcare system.
Okay.
I love the idea of building habits in order to have a healthier life, right? And do you envision yourself doing some kind of crazy technology in the future, like behind some high-tech product or something related?
So, the technology that exists today that we will leverage in healthcare, which I can only see getting better over time, and us possibly being involved in coming up with a solution that consolidates information or patient health data and makes it actionable, is something where I can see us being a part of. So, for example, we're going to be doing in our doctor's offices VO2 max assessment, resting metabolic rate assessment, active metabolic rate assessment, chronic disease risk analysis with something called ankle brachial index testing. There's all these technologies, DEXA, body composition analysis, that collect patient health data. And that's useful. It's necessary. However, it's not applicable. Patients don't know what to do with that information, and I would say most traditional primary care or healthcare providers don't know how to make that information actionable for patients. And so consolidating that information and making it practical and applicable via lifestyle habits or behavior change interventions, I think is where we see ourselves helping to innovate and potentially coming up with a novel product that actually can consolidate this data and make it useful for people.
Great. On that note, I want to add that we've been reading a couple of articles that discuss that the wellness industry today, there's so much information that it may cause, or it has caused in some people, kind of like an anxiety. I think that's the right word. And I think that the fact that you are looking to interpret this data for the patients and help them discover what their next steps are, that's super, super important, because there's so much information that it happens to everyone. We don't know what to do with that data, or we freak out about little details that don't need to be even looked at, or we overlook details that we need to focus on.
Yeah, I mean, Belen, great point that you're making there. And yeah, I believe that's absolutely true, that there's it's more so than FOMO, this fear of missing out on the next health trend, or it's greater than that. I think that the way the information landscape is today in health is confusing. It's overwhelming. There's many sources without much reliability or there's continuity in terms of the messaging. And I think the issue there is people are capitalizing on the health information industry. Like healthcare is the top three biggest industries globally. So there's a lot of money to be made in healthcare, intriguing healthcare messaging alone that sends people down toward a product or a service. And so there's kind of these misaligned incentives in the healthcare information landscape that makes it so that there's a lot of mixed messaging and not a lot of reliability. And so that's kind of like one bucket is like there's this general overwhelm in terms of health information broadly. And then there's this like personal health information kind of anxiety that you could get, when you're like wearing a biometric analysis thing on your wrist and you're using a nutrition app and you're, maybe doing a fitness program, you get this information overload that it starts to kind of like take over your life, and it can actually deter people from making progress or be this cause of like unnecessary angst or anxiety. Like how counterintuitive is that, right? You're trying to do these things for yourself and your health and self-care and to feel better. And then you just end up kind of like be lost or feeling
Exactly,
worse.
exactly. And then like people tend to then stop and don't do anything at all, and that creates exactly the opposite that it should be creating, like
Yeah, you get like fatigued on all the things you're trying to do. You're trying to like do breath work and work out and eat better.
meditation. Yeah.
Yeah, and so like, and it's easy to want to do that when there's like things yelling in your face, hey, this is the most important thing for your health, and this is the most important thing for your health. So, you know, the way we're approaching it is that it's actually in our name, true health. And the part of what's behind that is, one of our aspirations, if you will, is to become a source of truth with regard to health information and people's health that is reliable and consistent and also backed by actual practitioners, right? People who have MDs and PhDs and are also working in practice. A lot of health information today comes from researchers, and that's fine. And a lot of those people do a good job of kind of like saying, here's how you might go implement this your life. But like, what services are there that are affordable that people can actually do that will take them on this behavior change journey? And so, like, we're trying to filter everything through the lens of is this practical, right? Is this applicable to actual like patients' lives in terms of how they behave every day? And if it is, how can we show them the path, like, and do so in a systematic way that's actually sustainable? And so, yeah, that's definitely, I would say, another kind of like, even Tom, like a big problem we'd be looking to help contribute to the solution for.
I like what you say about your single source of truth, right? Because in the end, it's that, right? Like what you're trying to communicate, to share, and it is great. So since we're running out of time, we have a little section that is called the yes, no, where we have a couple of topics for you. We want to understand, based on your single source of truth, and of course, based on your opinion, if you support that, or you prefer like you instead of that you prefer to keep that apart from a healthy routine. So
Sure.
first of all, we have always prioritize strength training over cardio. Do you think that's a yes or that's a no?
So
It's a complex one, right?
You have to try. You have to try your best to stick to a yes or no. Of course, there's like
You can give us a
there are
little
gray areas. We know that, but still.
then yes, and then I'll just say that for my own credibility here, there's some nuance there. Like
Oh, yeah.
both are.
Of course. I mean, everyone is unique, and I think that's like a very important message and purpose in True Health as well. So not
Yes.
for everyone, strength is always more important than cardio, but like in general, if we
Yes. So I will say this, like for a lot of people want better body composition, right? Like there's health benefits to having better body composition. There's energy. There's, uh, you know, there's the aesthetic component to
yeah.
that. And then in terms of like purely one big component of longevity is for sure lean body mass. Um, and obviously there's cardiovascular implications here that are not lost on me and are right on par with that. But yeah, I think people will get a lot of bang for their buck if they like start to prioritize strength training more, if you will.
Okay,
Good to know, good to
great.
know.
I'm gonna go next. What about GLP-1 medications? Is that a yes or a no?
So those are fascinating. You know, I think there's a lot of potential use cases actually with like addiction potentially in the future and them kind of being this like anti-hedonic
Yeah.
intervention for things like even like alcohol abuse potentially. And you know, I think that is in terms of like technological innovation in pharmaceuticals, it's certainly uh, you know, it's a big breakthrough. However, I think there's also simultaneously with any big breakthrough, there's going to be this kind of like whole other category of misuse where you start saying it's a panacea and it can solve all issues. You know, I think type 2 diabetes, for example, to bring down someone's A1C and for the specific application of helping manage chronic disease conditions that are diagnosable, it's a very good solution. However, it can't exist alone. It has to be coupled with lifestyle intervention so that people learn how to eat enough protein so they don't lose lean body mass while they rapidly lose weight and so they can stay metabolically healthy while losing weight, and then also to have sustainable weight loss and having nutrition knowledge that actually like backs this up because it's also about what you're nourishing your body with, not just pure calories in, calories out. So, you know, I could go on about how GLP-1 has probably been blown is now in this realm of like there's a whole category of legitimate use and there's this whole category of improper misuse where it's almost being used as a shortcut to not have to do the hard work of lifestyle intervention in the case that someone might not like clinically need the drug. And so, yeah, I think there's a lot of use there, but so I actually opt out of a clear yes or no on that one.
ChatGPT told us that this was going to happen. So.
Yeah, there you go. There you go.
Okay, so the next one, please tell me yes, because I just bought an outdoor bathtub. So Wim Hof method, yes or
Okay.
no?
Yes, breathing is so important. Breath and I'll say like breath work, yes.
Okay.
Like
Breath work.
Great.
Not just the
proper breathing, huge implications on
Okay.
your health for sure.
What about the 5 a.m. club lifestyle? Like,
Okay, no. Even though I am a early riser
Okay.
personally, people have preferences, and I think I think the science on this is you can find stuff supporting it and not supporting it. That there are more night owls or early birds. People find restoration and I don't mean restoration in terms of rest, but like personal time. I think the notion behind 5 a.m. club is like you get up early and get your stuff done before everybody else wakes up. If you do that at night, who cares? Like, if as long as you get good sleep and you're managing your stress and you're getting your exercise in and balancing that with like family life and seeing people you love, do it whenever you want. Like,
great. Yeah, totally
So-
agree.
yeah.
it's
Yeah.
simpler than it gets. Well, intermittent fasting.
Okay, I'm gonna say no, and that might ruffle some people's feathers.
Okay.
And the reason I'm saying no is because, for context on this, I graduated with my master's degree from University of Illinois Chicago. One of my professors there is a big intermittent fasting researcher, and she would tell you that this whole category has been kind of now muddied. So intermittent fasting in research typically, now there's a little bit more on this, but there's kind of these like one alternate day fasting where you're fasting for a full 24 hours. There's multi-day fasting where you're fasting for extended periods of time, like quarterly or yearly. And then there's this kind of what is actually called time-restricted eating. And this time-restricted eating is now what people refer to as intermittent fasting more broadly. So like, intermittent fasting has multiple categories that you don't always know what someone's talking about. So it's confusing. And then like time-restricted eating isn't as important as caloric balance. Like it's one method. So time-restricted eating is just a diet method. There's no like magic that happens necessarily. There's benefits, right, to like not eating at all hours of the day in terms of circadian rhythm, and like probably metabolic health. So I do suggest people be on a meal timing schedule, so to say,
Yeah.
where you're eating the same meals at similar times of the day. You are spacing meals appropriately, or snacks appropriately, and within reason. However, time-restricted eating is just an easy way for some people to restrict their calories, and so therefore lose weight. Like if those calories restricted and versus taken in, are at a net negative, or in a balance that they're able to lose weight. So I don't need to go on too much about this. I'm kind of rambling, but like it's just another method of calorie restriction.
Yeah. Absolutely.
I'm taking a lot of mental notes here.
Yeah. Good.
Do you want to go with the last one?
What do you think about AI-driven wellness coaching?
Okay.
Difficult one there.
Is this still yes? Is this still yes, no?
Yeah. No,
Okay.
yes, no, exactly.
Yeah.
Exactly, sorry. It's a yes, no. Yes or no,
Yeah.
AI-driven wellness coaching?
No. However, AI augmented wellness coaching, so would be a yes for me. So no to there not being a human on the other end of this.
Okay.
Like people know the emotional journey of changing health behavior. You need a thought partner. Like if you really want to, because changing health behavior is a human experience. Like you can get great information if you're using AI to augment your learning, to help a health coach make decisions about how to guide people toward better health. And I believe there will be great tools that give people real actionable, practical advice. But if you're looking for a coach, like find a person who can like also understand the emotional nuances, because like I said, information or data is just one fundamental and necessary piece, but it's not what actually leads to change. What leads to change is like having a clear and practical plan that fits your lifestyle, and also considers the emotional implications of taking on these like health behavior changes. So no on that.
Okay. Awesome.
Yeah, and I think the social part, it's an undeniable vertical of the holistic wellness that we are looking for. So yeah, it makes a lot of sense.
Exactly.
Alex, thanks a lot for your time. We have a list of these yes/no topics, and we could be the whole day. Because we are like asking this for ourselves, right? Because I have so many doubts, and I love hearing your opinion. but we want to make this to keep this short. So thank you again for having you here, for your time and for your knowledge. We'll see you again sometime for sure.
Yeah, thank you. And yeah, feel free to send over those yes, nos, and I can
Awesome.
answer with some
Thank you.
nuance for you personally. But yeah, I appreciate your time today, and this was great.
Awesome. Thank you so much, Alex. I hope you have a great day, and we'll see you sometime soon.
Likewise.